All right, let's clarify one thing. So we talked about what the word patient means, right? And I think I was sort of rushing, so I skipped over it, but it's really important. That concept of patient really has two senses to it, if you will. So one sense is information gathering, information possessing. That's the phone conversation, prospective patient. You've got personal information about them. I think that's the information that still would be privileged. There's another sense of patient, though, meaning ongoing patient responsibilities. And you wouldn't have that, especially when the patient said, your fee's too high, I'm not going to see you. All right? They basically ended the relationship, right there. So if they suicided 3 weeks later, that would not be your problem, right? Because you never were their therapist in an ongoing daily, clinical responsibility sense. You would be responsible for the information, right? So privileged patient, two senses, information and then ongoing treatment responsibilities. Treatment responsibilities ends with the termination, right? All right, so another concept that's critical is psychotherapist. Pretty straightforward, right? Someone who is or is reasonably believed to be by the patient to be a psychotherapist. Got your usual suspects there. Evidence Code 1010 gives us the list. Pre-internet, this was much more difficult to determine whether somebody was or wasn't a psychotherapist, right? Nowadays, you can go online and check out somebody's status. It's updated daily. Do they have their license? Has it been suspended or revoked? Is it active? You can check all that stuff online very easily. Patients have become more and more savvy about that. But basically, the law is not going to punish the patient unless they, really, they would have to know that your license was inactive to compromise privilege. As long as they reasonably believe you're a valid psychotherapist, privilege is going to be intact. All right? That's the simplest one. This one's the most complex, confidential communications. All right? In fact, this definition bleeds over. I think it's into 3 slides, so bear with me. What we mean by confidential communication is going to be information transmitted between the patient and the psychotherapist. Makes sense? Made within the course of that relationship, the professional relationship. Made in confidence. And that's the issue we've got to be concerned about eavesdroppers, right? And this is why doing therapy at Starbucks is not a great idea, right? Because third parties may be able to overhear what we're talking about. And if they can overhear what we're talking about, we don't have privilege then because those communications weren't made in confidence. Hence the white noise machines, right? Where we're trying to, protect patient information as much as possible. But that's why we like, 4 walls around us and closed doors, right, and quiet atmosphere. It doesn't mean, you couldn't do therapy outside of the office. It just creates that challenge that we've got to be mindful of, right? The presence of third parties who could overhear, and if we've done so, we've hurt privilege then. Made by a means which, so far as the patient is aware, discloses the information to no third persons, right? So the law envisions some third persons that's still inside that concept of privilege. Who are those folks? Here we go. Someone present to further the interests of the patient. Well, to me, that sounds like collateral, right? They're there. We're getting information from us. We're giving information to them, or they're there to support the patient. Present to further the interests somehow. Are all cases? No. This language is pretty vague. It's waiting to be used by lawyers in appropriate cases. We'll see how it plays out. But that's the first one, is present to further the interests of the patient. 2 is necessary to transmit the information. Oh, question?
If I'm teaching a client on information, help him in his personal social life, is that considered psychotherapy?
So you're teaching a patient, like skills?
Yeah.
Okay. What are we teaching? What are the skills? Is the stuff you learned in your graduate program.
Probably how to stay clean and sober with education.
Stay clean and sober with education.
Only education.
Yeah, closed door though, right?
Yeah.
Are they signing your paperwork?
They haven't. No paperwork. Just on any materials it says it's not psychotherapy.
It's not psychotherapy.
Right.
So, there's no case that differentiates the skills teaching, because that could be part of therapy. I could see that as part of a treatment plan. So a lot of it depends on the content. All that would factor into it. I'd always be mindful of trying, again, to wrap confidentiality and privilege around, what you guys do. But you'd have to really look at the setting to make a clear determination. Right? All right, necessary to help accomplish the purpose of the therapy. What does that mean? No idea, right? It means what the cases ultimately are going to interpret it to mean. But how about, let's say we have to send a bill to an insurance company. Does that destroy privilege because we sent a bill to the insurance company? Or we would argue, no, that's, they get to utilize their insurance. That's to help accomplish the purpose of the therapy, or it's necessary to further the patient's interest. We would argue that should destroy privilege. Right? So again, not every question has been asked or answered in these things. We have to see that these are principles of law, and they're going to get applied in specific cases, right? But there's arguments on both sides that can be made. And the other thing that I think is really important to stress is, with privilege, we're talking about court. Right? We're talking about an administrative law proceeding. We're talking really about where testimony can be acquired. If we're not at that level, the laws on confidentiality, not privilege, might be what control the flow of information within the setting. And there are more laws on confidentiality than there are on privilege in terms of flow, right? So something might be justified by virtue of confidentiality laws, not so much the privilege laws, right? That's a really complex area. All right, so here's the one case I alluded to, the Manila case, child custody battle, hotly contested. The court said wife's presence at husband's examination rendered husband's communications with his physician non-confidential and not privileged, in light of a lack of any evidence that wife's presence was reasonably necessary for physician's diagnosis and treatment. Wow. So here's what happened. Husband has a tic disorder, and he's saying it's controlled by medication, right? So it's not a problem. He's managing it. Wife is saying, oh, no, this is serious. Because when these things come on, he goes into convulsions, and therefore he's not safe to have the child because he can't supervise him because of this underlying disorder, right? So is it just a tic disorder that's controlled by medication, or is it a more serious sort of thing? That's what they're fighting about. Well, for whatever reason, wife was in one of his sessions with his neurologist, and husband's describing in detail what happens to him when the seizures occur, right? So wife says, must have had good lawyers. Wait a second. Why is wife in his medical appointment? Let's go back to our list of things, right? Was she there to give the doctor information? What will we have in our records to evidence that? The word assist, right? Somehow, we're getting information to assist in our treatment. Was she there to be educated by the doctor about the seizures? There was no mention whatsoever about why she was in that appointment. And that's critical. I'm reading through this case for the first time, and I'm thinking, make an argument, for gosh sakes, right, as to why her presence was necessary. They had no reason whatsoever. So the court said that session not protected by the physician-patient privilege. Therefore, the neurologist had to testify about what occurred during that session, because having a wife in there with no good reason destroyed the confidentiality of it. So it underscores that collateral issue. It's okay to utilize third parties. We just want to make sure there's a good reason for utilizing those